Okay, everybody, I think we're going to get started. Good morning. It's a nice morning to be here. I was asked to introduce Dr. Major about 2 minutes ago, which is my absolute pleasure. So, I'm not going to go over his CV or anything, but when you look at mentorship comes in many ways. It can come with Myron sitting next to you and going, word by word over a paper. It can come with Vesna, looking at globally how to do things. It can come as Dave Chatterjee, talking about life and sort of financial decisions. And then you look at Tom, and he's also sort of a total package with it. And he can combine what he calls the 30,000-foot view of the direction you're going with even the minutia of how to make tactical and strategic decisions. He's got a wealth of knowledge, a wealth of experience. He's been in academics, he's been in somewhat in private, and he's been in the military. So I listen to him, and I think you should also when it comes to especially things like this. So without further ado, before we start, in the back, later on, you're buying T-shirts, okay? Donate to Courage Classic. If you don't want to donate, just buy a T-shirt. They're hysterical. They're the We Sedate You Colorado. I'm already working on next year's, so get these while they're hot. We got to cover a certain amount, so I'm not paying for them, but we'll be in the back. We take Venmo, we take credit card, we take cash. $25 for one, $45 for two. After that, I'll make a deal for you, don't you worry. So anyway, come visit me up there afterwards. Please, 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 please. Without further ado, my mentor, Dr. Major.
Thanks for that kind introduction, Alan. So today we're going to talk about, so you think you want to get an MBA, and it's for people that are thinking about getting an additional degree, maybe while they're in residency or afterwards or anytime during their career. And the audience for this can be any kind of provider or any kind of researcher, really. It doesn't have to be a physician. It could be a CRNA or an AA. It could be a PhD who's dealing with the business world of the economics of research. So it's really aimed for anybody, I think, in this audience that may want to increase their acumen when it comes to leadership in the business side of medicine. So show me who the anesthetists are in the group. Show of hands, just so I know where everybody is. Okay, how about residents and fellows? Okay, and then attendings? Perfect. And anybody who's, besides Paco, who's a PhD doing research? Awesome. Okay, so I learned a little bit about you from that show of hands, but I want to teach, before we get started in the real meat of our topic, a little bit about our hospital. So I'm the section chief over at Children's. Children's is a 600-bed, freestanding, not-for-profit healthcare system. So it's a system now because we consist of 3 hospitals that we cover anesthesia for, and then a 4th hospital that just opened down in Colorado Springs that's covered by the UCH MG, or the private practice arm of UCH Anesthesia Group. Children's has 60 pediatric network locations across 3 states. So these are clinics, urgent care, after hours care, that kind of thing. And we consider a 7-state catchment area, and you can read the states of which patients are drawn to Children's, kind of in a hub and spoke type of feature. We have about $1 billion in annual revenues, and we have a 6% operating margin or profit to be reinvested back into the hospital. We have a level 1 trauma designation that's been active for at least 10 years. We have a maternal fetal center, so we actually deliver moms carrying sick fetuses over there who need intervention either in utero or immediately after birth. And of course, we're University of Colorado affiliated, in that all the physicians that work there are CU employees. So to drill down a little bit and talk about the anesthesiology statistics, I run about 46 locations in 3 facilities. The 3 facilities are Anschutz, right across the street. The North Hospital, which is at I-25 and where E-470 intersect, just a little north of there. And then the South Hospital is catty corner from the new Highlands Ranch Hospital in Highlands Ranch. We provide 24/7 in-house coverage for the operating room. That consists of an attending and an anesthetist or a trainee, depending on the night. And then we also have 24/7 in-house coverage for OB because we have laboring moms that could come in at any point in time. We have 24/7 pager call for fetal, transplant, cardiac, acute pain. There's also chronic pain. The South Hospital does appendectomies and other procedures at night, fairly simple procedures. And then we have an away designation because we also follow our surgeons to the St. Joe's NICU for neonatal cases that are done over at St. Joseph's Hospital. And of course, we come to UCH to care for any children or babies that are done either in the NICU or in the OR, and then also in the rad-onc portion of UCH. Even though we have 46 locations, there's a lot of flux in the number of locations we run, and the average number of anesthetizing locations is about 38. And then to drill down to the most important part of our operation, our people, we have about 54 attending physicians. They're not all full FTEs, but that's how many people we have. We have about 30 anesthetists. We have 2 psychologists that cover mostly chronic pain type of work. We have 5 advanced practice nurses working in both acute and chronic pain, and then 1 in cardiac that helps to manage that whole service. Trainee-wise, we have 7 pediatric anesthesia fellows, 4 advanced track fellows, and we have about 4 residents a month from the CU program, and we really enjoy having those residents with us. Takes a lot of support staff to run this operation, and we have a division manager, Andrew Rice, Director of Operations, Andrew Rice, who has his MBA. And Steve Oswald just helped us to write a job description for division manager, who's going to manage basically all the personnel issues and finances for people that are CU employees. Then we have the rest of our kind of unsung heroes, 6 admin assistants, fellowship coordinators, 16 anesthesia tech, a tech manager that oversees the anesthesia techs, 2 research nurses, chronic pain RN, physical therapist, social worker. So there's a whole bunch of people that make our operation work. I'm really proud of each and every one of them. So let's get on to the meat of the lecture. I have no disclosures other than I attended USC, Sol Price School of Public Policy. And USC's been in the news recently, hasn't it? Maybe not for great things. So it's a difficult school to get into. So I wanted to make sure that my application was up to snuff. So, I put in this picture of my rowing career to make sure that I'd have an easy in into USC. But all kidding aside, these are the points that I want to cover. Why would you want to go back to school after 20 plus years of schooling and on-the-job training that you've already been through? When's the ideal time to earn your degree? Which degree should I pursue in the business realm? And which program should I attend? And notice I had up there, which executive degree should I pursue? Executive just means that it's basically online learning or distance learning in various forms. And each of these programs have a differing period of time that you actually have to be in residence or on campus. And so when you're looking at these programs, that has to figure into your calculation as to whether you can afford to spend that time there, whether you want to actually go to that city, how hard it is to get to, and how long you need to be there. So we'll try to hit all of that for you. So to address the first question, why would you want to go back to school? So these are kind of the standard reasons that you see when this question is asked. Improve your business acumen if you want to run a department, like Vesna, run a section like me, if you want to manage a practice in private practice or help to manage a practice. Do you want to improve your management skills to keep a team running smoothly and to know how to work with a team? Do you want to get technical training? Do you feel you're lagging behind in the IT world? Do you need to know more about what's going on IT-wise in your hospital or your organization? And then the reason that probably most of the people in my cohort went back to school was to have an opportunity to work for a large healthcare organization, especially in research and administration. And there are people that are shooting for the COO position or even the CEO position that were attending school with me, and some of them are getting there. But there's really a much more compelling reason to go back to school, and that's we're going to need some very serious help in the coming years in figuring out what lies ahead in the business side of medicine. And healthcare in the near future will be facing a crisis of epic proportions, and I want to submit to you that that crisis is already here now. We're just kind of seeing the tip of the iceberg now. So let's look at these tables from the CMS website. On the left side is the main cause for this crisis, but there's a lot of things that figure in, including Obamacare and just the cost of medicine in general and how it's practiced. But look at that graph on the left. It shows a projected number of Medicare beneficiaries, and it's increasing at a rapid rate owing to the aging of the baby boomer generation, people like me. And there is no sign of leveling off for quite some time. You see the graph extends out to 2022, and these are Medicare beneficiaries in the millions. And you can see right now we're maybe in the 50 million range, and it's going to peak and maybe continue to increase a little bit more above 60 million. So that's a boatload of people. So on the right, you see some bar graphs that indicate that by 2022, Medicare will actually make up the majority of healthcare constituents. So more than Medicaid, more than private pay. And you can see the Medicare pool in 2022 is this large red bar, which shows 58%. So there's going to be a lot of old people. We have a lot of old people now that we're taking care of, but there's going to be even more in the coming years. And there's one thing that we all know about the elderly is that they have multiple chronic diseases. Many have as many as 4 or 5 chronic diseases that are significant, like diabetes, congestive heart failure, coronary artery disease, so forth. And all of you are familiar with that who are taking care of adults right now. This makes them incredibly expensive to take care of. So in this article that this picture came from, which kind of shows us falling off the edge of a cliff, is from Perez, who indicated that in 2009, U.S. hospitals experienced a negative margin exceeding 5% caring for the elderly. In other words, for every elderly person that the hospital takes care of, they're losing 5% on that individual body of care. And in 2018, and these numbers haven't been confirmed yet, this was last year, aggregate margins of negative 10% were expected. So this is a huge loss. They're not making money on taking care of the elderly with all these chronic diseases. They're actually losing money. And so this is the one chart, the kind of economic chart that sums everything up. And if you don't remember anything else from this lecture, this is the one that I want you to recall. So the black line going across the middle, the solid black line, represents the average federal revenue between 1965 and 2005 as a percent of GDP. Where does the government get its money? From taxes, right? So this is basically the cumulative number of amount of taxes that are collected, and this is how we run our country. The colored areas represent each of the 3 types of entitlements: Social Security, Medicare, and Medicaid. And so you hear a lot of talk about Social Security and how it's in a crisis. Actually, Social Security is pretty stable. But look at the upslope of the cumulative spending that's attributed to mostly Medicare and a little bit to Medicaid. And guess what happens when this graph crosses that black line? Country basically goes bankrupt, right? Because you're spending so much more money than they're bringing in. We're a little bit in that situation already. So you might ask, well, why am I telling this to all of you? What does this have to do with all of us? And it turns out that there's evidence that the most successful hospitals are run by healthcare providers. And it's not just physicians. Dory Beaster, who's a friend of mine, used to be the CEO of Children's Hospital and was very, very successful. And she was an RN by background. So the Mayo Clinic is, year after year, thought to be America's best hospital, according to U.S. News & World Report ranking, whether you believe those or not. Cleveland Clinic typically comes in second. The CEOs of both John Noseworthy and Tom The study in 2011 also indicated that physician-led hospitals had quality scores that were about 25% higher than those that were run by pure MBA types who didn't have a provider background. So in my opinion, the answer to this coming crisis is to have more of us, to have more providers who really know our system inside and out, take on leadership roles and help figure out how to avert or how to get through this crisis. Who better than providers can figure out that are trained in business, figure out how to bend this cost curve. So then, now that I've made my point, if you're still interested in pursuing a degree, when is the best time to earn your degree? You know, there were a lot of newly minted physicians that just came out of residency that were in my class. And they had no leadership position currently. They were just doing it kind of just because. And is that a good enough reason to get your degree? Just because will get you increased insight, maybe make you a better steward of your hospital, but it's not worth the $60,000 to $80,000 and all the time invested that it costs to get an MBA. So I submit that these folks probably are not getting their degree for the right reason, or at least at the right time, because they didn't consider what their return on investment was going to be on their education. So these 4 bullet points are 4 of the best reasons probably on when you should earn your degree. There are many that earn it as part of residency. If it's followed by a fellowship period where you actually work in the department and test your newly learned skills. This is what Brian Davidson did. Many of you know him. He's currently the president over at St. Mary's Hospital on the Western Slope. Brian went to the local CU program here and earned his MBA degree while finishing up his residency. And then he stayed on afterwards and worked in the department, tested his newly learned skills, then went to the Western Slope as, I believe, the chief medical officer, and then went up the ladder to president and CEO. So that's probably one good scenario. A second is after you've had some experience in leadership roles. In other words, not right when you get out of residency or fellowship, but let's say you've been out for 5 or 10 years and you're chairing some committees and you're running certain aspects of your hospital. This way you have some experience to draw from when you participate in your business school, and you also then will be able to give back to your hospital in ways that are better than before because you have all this newfound knowledge. Third is the reason that I got my MHA. It's something, or MBA, it's something that I'd wanted to do for a long time. But I knew that the position at Children's would be vacant for the section chief, so I went ahead and pulled the trigger at that time because I knew I had an opportunity that I wanted to vie for at Children's Hospital, so being poised for program leadership. And there's a final reason that some people may not want us to talk about, and that is if you want to transition from medicine. Let's say you're completely disillusioned with what I just told you, you're really not enjoying practice and you made a wrong decision to go into medicine. There are some physicians that use an MBA degree to transition from medicine into a different area. Oh, and when you consider this timeline curve here, you may not want to wait till you're 60 like me, but I guess better late than never. So next question, what degree should I pursue? People really get confused with the alphabet soup of the different types of degrees that are out there. There's medical management degrees, there's management of health administration degrees, or MHA, there are pure MBAs, there are MMMs, which are medical management masters. So there's all kinds of different alphabet soups of schools that you can go to. So how do you make this decision? Well, the first decision is really to decide that very last point that I brought up. Are you trying to transition from medicine? If you are, then you should get a pure MBA that teaches you business concepts, not just related to healthcare, but related to business that goes on in the whole world. So that's really the first point that you need to tuck out of the way. After that, if you are deciding to do this to work within healthcare, then any of these other degrees are great, but the proof is really in the pudding, right? So you need to go to the school websites, get more information from the schools you're interested in, and actually look at the curricula and see what they contain and see if it looks exciting to you or if you're bored by it, to see if it fills a niche that you're trying to fill within your business acumen and so forth. And so what I want to do as kind of to wrap up the lecture in a couple of slides then is to look at a few example programs, walk you through some of the curricula, or at least give you a chance to read what all is offered in these various programs. And then I can fill in for you the length of time that these programs are and how much they cost. And by the end, you'll have some idea of maybe what type of program you would choose. Before we do that, though, let's talk about admission requirements. So people are always concerned, do I need to go back and do some kind of standardized testing like the GMAT? Typically, it is not required. These schools look at your bachelor's record if it's a school that accepts non-physicians, which most of them do. There's a few physician-only programs, and we'll go over those. But the GMAT isn't necessary typically for these programs. They look at your bachelor's degree, your medical degree, and the history of leadership experience that you've had in the first few years. And the way it's typically termed is 5 years or more of increasing leadership responsibility in a healthcare organization. That's probably the most important thing that they look for. Which program is the right one? We're going to look at the curriculum and consider that. It depends on your goals, as I mentioned. It depends on how many in-residence sessions there are and how long they are. Can you really afford the time to leave 1 weekend a month or 1 week a quarter for 2 years, for example? What's your learning style? Do you like a program where it's all electronic and all on computers, which would have driven me crazy? I chose one specifically that had kind of a combination of online learning and textbooks. Do you want to go to a physician-only program? There's some people that think this is the way to go if you're a physician. It's kind of a shortcut to exactly what you need to know. I found physician-only programs to be a little bit narrow-focused. And the thing I enjoyed the most about my school was interacting with the nurses, the quality people, the administrators, all the other different types of people that were in my program, because I learned from them, from their different life experiences than I had. Some of the physician-only programs typically find a physician sitting in a corner talking about clinical cases. That's not why we're there. We're there to learn about business. So that was just my spin, but everybody has a different view of it. You need to look at the duration of the school, and I'll show you one that's a very short duration, only 1 year, and I'll tell you why I chose not to enter into that program. And then you need to consider costs because the costs vary a little bit from program to program. So let's look at the first one. I didn't attend the school at CU Denver, but I'm highlighting it because it's probably the best deal and it's the closest deal that you can get when it comes to getting your MBA in a healthcare type environment. The school is located at CU Denver. It gives you your MBA in health administration in a 24-month period. There's 1 week in residence twice a year, which you can easily do on the downtown campus. The cost is $59,000, but there's a steep discount to CU employees that you can take advantage of. And the last time I looked when I was applying, it was a 50% discount. So this is a really, really good deal. You can read some of the core courses, the electives, and about the health capstone course. And it's actually a gem that we have in our own backyard, a very, very high quality program. It's open to physicians and non-physicians both. And the people that have gone to this program said they really like the interaction of those different kinds of people that are participating in this program. So this is just a snippet of the things that you will learn in the Kelly School of Business, which is at Indiana University, the program where I was an anesthesiologist for years before I came here. This is a 21-month program, but it's a physician-only program. So again, that kind of narrower focus, maybe if you want to look at it that way. 10 to 15 hours per week is a commitment, kind of your learning time during the week. And then they want you to come to Indianapolis for 1 weekend a month. So this is a lot of travel out of town. Choose up that 1 weekend out of town to go to Indy to be with the rest of your cohort. The cost is $85,500 for a 2-year, 21-month program. It's pretty pricey, but it's a good program. The one thing that's interesting, you see on the bottom right, this executive coaching for physician leaders, they actually give you a coach who's typically somebody who has industry experience, and they'll help coach you one-on-one in areas that you might be struggling with in your leadership role back home as you go through this program. So it's a pretty innovative aspect. And there's also an experience to study abroad, and a lot of these programs will allow you to go overseas. It's part of the curriculum to see how things are done in a different country, get a little different spin on things. So if that's something you're jazzed about, maybe consider the Kelly School of Business. Here's one that's really interesting. It's the Haslam School of Business Executive Medical MBA. It's called a PEMBA, a Physician Executive MBA. This is also a physician-only program. You can see all the things that you learn in this school. The thing that's interesting is that this is a 1-year program. And I was advised to go to the Tennessee program when I first started looking because the people that were advising me said, look, you're an old man, you got to punch your ticket and just get done and move on. And so I actually signed up for this program initially, and then I started to look at how much time I would have to spend away, which I believe is 4 1-week sessions in Knoxville during that year. Also, the cost is $76,000, and instead of that being spread over 2 years, you got to come up with that all in one chunk, basically, which I couldn't figure out how to afford that. But then the real kicker for me was that this school takes about 40 hours a week of distance learning at home behind a desk, and there's no way I could have done that and worked full-time as an anesthesiologist. So this one was initially at the top of my list, and it fell to the bottom when I thought about the logistics of going through the program, even though I would have been done in 1 year. Here's a program I went to. It's at USC in Los Angeles. It's actually through a school of public policy, not a business school. And I did this intentionally because I didn't feel I wanted to sit and learn accounting and spreadsheets, and that's all. I wanted to learn more about the global aspects of healthcare. And that's how this program is oriented. And you see what some of the courses are that I took. It was a 2-year program. There's only 2 4-day in-residence periods in Los Angeles. The cost was $67,000 for everything, but again, that was spread over 2 years. And then finally, for those of you that are looking to get out of medicine, the Berkeley Haas School at CU Berkeley is an example of one of these. This is a straight MBA, but it's also an executive MBA where it's done distance learning. There are several physicians that are currently enrolled in the school, and my son-in-law was actually a full-time student at Berkeley Haas, and it's a really good school. This is a 19-month non-medical executive MBA. There are 5 in-residence periods, and the cost is $185,000. So some of these are very pricey. So when you start looking at Berkeley, Kellogg, Wharton, they're exorbitantly expensive, and you got to figure out how to pay for them. So shifting to that, how in the world do you come up with $70,000 to $180,000? These are all the options that I could think of that are legal. You can use cash. You can borrow from your retirement. There's ways to do that, and you kind of pay yourself back over time. You can refinance your home. Sounds funny, but I actually did this. I refinanced my house to take advantage of a lower interest rate, and I used some of the equity to pay off what I had left over in bills at the end of the program. I used my credit card when I was a little bit short and got a lot of points and then paid that off. I also took out an unsubsidized Stafford loan, which is really the only kind of federal loan you can take out. It's a good interest rate, 5 to 6%. It's fixed after you take out the loan, so you don't have to worry about the inflating cost of the interest rate. But there's a $20,000 per year maximum. So my program was about $35,000 a year, so I took out 20 from this. I used my credit card and cash to pay for the difference, and then kind of paid that back. And then at the end, I had 10 or 20,000 that I finished off by refinancing my home. So I kind of did a combination of these, right? Now, how about that last one? Get somebody else to pay for it. There were a lot of students in my class that got their corporations to pay for it, but you have to be careful here because, number one, that's not something that CU lets us do, so it's kind of out of the question if you're employed here. But secondly, it always comes with some kind of a tail, because if they are going to pay for your education, then they want a chunk of you for a period of years afterwards, and then you're tied into that even though you might have a better opportunity elsewhere. So be careful about that last one. It's a good way to go, but doesn't maybe give you all the flexibility that you want. So why would you want to go back to school? It's basically to lead a program, to aim for the executive suite. But my point today was, don't you want to improve and preserve healthcare if you're going to be working in this field the rest of your career, especially for young providers in the audience? When should you earn your degree? As part of a fellowship after residency, after some degree of leadership experience, or if you're poised for program leadership, and finally the one if you are really disillusioned and are looking to get into something else. What degree should I pursue? To summarize it, look at the programs and do what you enjoy. Do what you think would make you happy. I thought this program would be miserable drudgery. It took every weekend, literally, for a 2-year period of time. But you know what? I looked forward to sitting down and doing this classwork, meeting online with my colleagues during the week to talk about current problems. This was more fun than my anesthesia job, and I love my anesthesia job. So I chose the right program for me, and it was really fun for me. It's a huge commitment financially and time-wise. So why be miserable, right? So look at a program and figure out what you would enjoy the most. And then finally, things like curriculum, the pace of learning. Do you want to squeeze it in a 1-year program? Do you want to spread it out? And cost all come into consideration as well. So hopefully for those of you that are thinking about this, maybe you've got an inkling as to where to start. Most of your research can be done online. These programs all have very robust websites that help walk you through the process. And I really want to thank you for your attention, and we've got a little bit of time for questions. Yes?
Yeah, a comment and a question. So CU Denver School of Business has decreased their discount for us to 20% now, but it's still generous. So
I was hoping one of you would have an update, because it used to be even higher than that, but thank you.
So the question is, does UC Health have any kind of a mentoring program that people who are in the process of the MBA, where they will mentor opportunities or look for places for those people?
So the question is, does CU Health have any mentoring opportunities for those that have been through this program? Not that I know of, but maybe those of us that have been through an MBA or an MHA should start that. Wouldn't it be cool to have a special interest group in our department or even broader that would look into things like this? Most schools do have placement programs. USC had almost monthly fairs where you could go meet employers. And a lot of my folks took advantage of that. But it'd be interesting to start something locally. Do you know of any groups that are getting together, any mentoring that's going on?
Just through CU School of Business. They make connections for all the students. Actually, it's part of the curriculum to look at the different opportunities around the country. But if you're interested in UC Health, I was just wondering if there was something local, and they don't have anything at School of Business that is local.
Okay. Yes, Alan.
What's the top reason to buy a T-shirt for the Curve Classic?
to raise money for the kids over at Children's.
And how do you pay? You pay by credit card, Venmo, cash? Is that right?
Any of those are feasible.
Okay, I was just checking.
I should have known. Thanks, Alan. Vesna. Brian, is that what you did? Brian Duggar? Tell me what are your thoughts now with using the retrospectoscope, and what was valuable about getting kind of a combined degree or doing it at the same time? And would you have rather have maybe waited till later in your career, or do you think it worked out for you? So, Brian, we're going to hire Brian at Children's, and I know the fact that he has an MD and an MBA figured into, and he's a great guy. I would have hired him anyway, but I think it puts him up a little bit higher than other candidates, because I know that right away he can start helping me with some of the issues that are going on the business side and the management side at Children's. In fact, I can already, when we work together clinically, I can already see his wheels turning as to, hey, Tom, what's going on here? And wouldn't this be a great idea to do this, that, and the other thing? So it's a benefit to have this as part of your MD. But I think it's really early in your career, especially if you're not going to be put right into some kind of a leadership role to test that experience. It'll involve some of the kicking off the rust. And the people that went through programs 5 years ago didn't even learn about Obamacare, and that was 90% of what we learned about. So healthcare is changing so rapidly that if you get your degree early on and don't use it for a while, there's a lot of rust that needs to be kicked off before you can be effective. Myron.
Tom, can you tell us about the ASA leadership course? What's that?
ASA has combined with a school, and I believe it's with Northwestern. Is that correct? In Chicago. Yeah, and it's kind of a mini MBA. We've had a number of our attendings, Tessa Mandler, Peter Fohr, Mark Twite, have gone through it. And it kind of gives you the quick and dirty of what you need to learn to manage an anesthesia practice. So I think it's a really good program. It gives you some insight into what you might be learning in a full MBA. And so there's some people that do this ASA-sponsored course and then go on to get an MBA, and there are others that are like, man, I've learned everything I need to know and become effective just after those weeks of training. So it's a really, really good program. It takes all the kind of crap and minutia and distills it down to what an anesthesiologist needs to know. And so I'm glad Myron brought that up, because it's a great kind of shortcut to get the information you need to help run an anesthesia practice. So good plug for the ASA program. So I have references at the end of my talk, but my contact information is here, and any one of you can call me anytime if this is something you're interested in. I can walk you through the process, answer any questions you might have that I could answer, and we'll kind of go from there. So my email's in the system, so just send me an email and let me know, and we'll get coffee sometime. I'll buy, and we'll sit down and talk. Thank you so much. Yeah.